What's up, you guys? Yusuf Ali Geek here in another video. Well, in tonight's lecture, we'll discuss a really high-yield topic, which is the nephritic syndrome, which is part of the renal pathology. So, without further ado, let's dive into the topic. So, what is nephritic syndrome? Well, the word nephritic comes from the word nephritis. So, what do you mean by nephritis? Nephritis is actually the inflammation of the kidney. Is it the whole kidney? Nah, it's actually the glomerular part of the kidney. So, what is the glomerulus? Those tiny blood vessels in the kidney that are responsible for filtration in a process what we call glomerular filtration. So there's an inflammation that happens in these capillaries or these blood vessels. So this may lead to impaired kidney function and various clinical symptoms. So, so what exactly happens, or what's the pathophysiology of the nephritic syndrome? So what happens is an inflammation in the glomerulus. The glomeruli becomes inflamed, and this often happens due to an autoimmune disease. Listen, the majority of the kidney problems or the kidney pathology is due to autoimmunity or immune disease and immune complex deposition. So, as a sequence of this glomerular filtration, the glomerular inflammation, what happens is that the glomerulus isn't able to do its function, which is the filtration. So the filtration will be reduced subsequently, and we won't be able to filter the waste or the excess fluid from the blood. So, if you take a look in the urine of this person or this patient with nephritic syndrome, what you will find is massive hematuria. And this hematuria will be the main differential factor from nephrotic syndrome. Because in nephrotic syndrome, we don't have any hematuria or limited. So, what's hematuria? Hematuria is actually a blood in the urine. So, what happens in nephritic syndrome, or the clinical picture of the nephritic syndrome, is hematuria and limited proteinuria. Well, actually, the proteins in the urine, there will be proteins in the urine, but in a very limited amount, like less than 3.5 grams. Also, there will be RBC casts and dysmorphic RBCs in the urine. You also got oliguria and azotemia. What do you mean by that? Well, azotemia is the accumulation of urea and creatinine in the blood. And oliguria is when we add the word "o" before any thing, we mean like absence. So there will be not absence of urine, but the urine output will decrease. Like the patient will realize that he ain't passing the normal amounts of urine that he used to pass every day. Okay, all right, sounds good. So this is the clinical presentation of the nephritic syndrome. You got hematuria, you got proteinuria. We didn't discuss this. So what happens in nephritic syndrome is um, there is hypertension and edema. So what's the main cause of hypertension and edema? Basically, the blood flow to this kidney decreases. So what happens is the cells of the kidney will release renin. So what does renin do? Basically, renin causes salt and water retention, like it arrests the salt and water in the body. And what this leads to is hypertension, and subsequently this leads to edema. So how we can diagnose the nephritic syndrome? We can do biopsy of the kidney, and this biopsy will reveal some hypercellular and inflamed glomeruli. Like the glomeruli will be infiltrated with inflammatory cells, and the glomerular capillaries will be like edematous and dilated. Also, we can do some imaging techniques like ultrasound or CT to evaluate the size and the structure of the kidney. Also, we can do laboratory tests. So laboratory tests will basically we'll find blood in the urine. We can find RBC protein cast, dysmorphic RBCs in the urine. we can find azotemia. So what's azotemia? Azotemia is when you find the elevated creatinine and urea in the blood. So that's azotemia. All of these are clinical pictures that we'll find in a nephritic syndrome patient. Okay, and also you can see the patient if he comes to your clinic that he has periorbital edema. So what's periorbital edema? It's edema around the eyes. Okay, so this is really an important topic, and this is a high yield topic that you really should stress and focus on, which is what are the differential diagnoses of nephritic syndrome? Well, there are quite many, but I selected the high steel topics, or the ones which come up in every exam, which are post-infectious or post-streptococcal glomerulonephritis, IgA nephropathy, lupus nephritis, glomerulonephritis. So guys, I don't want you to know any detail about these pathologies until we discuss them in the upcoming lectures, okay? So we now knew the what is nephritic syndrome, is the pathophysiology of this disease, what's its clinical picture, how we can diagnose it. So what is actually the management of this disease? Well, the management of this disease is we should control the blood pressure. We need medications to lower the blood pressure, reduce strain on the kidneys. We need diuretics and dietary changes to manage the fluid and electrolyte imbalances and reduce the edema. So what diuretics literally does is it increases the urine output, or it increases excretion. So excretion of what? We said earlier that in nephritic syndrome, the patient has sodium and water retention. So we need to excrete this excess salt and excess water, so we use diuretics. Also, we need to treat of this cause is, I said earlier that in nephritic syndrome, the majority of cases are because of an autoimmune disease. So we need to identify this disease and treat it. So what are the complications of nephritic syndrome? So the patient has anemia. So why exactly does this patient has anemia? Uh, um, Actually, the kidney represents a major role in the production of RBCs because it produces the erythropoietin hormone, which acts on the bone marrow and it stimulates RBCs production or RBCs formation. So literally, the person will have anemia because of renal failure, so we won't be able to synthesize this protein, so no RBCs. Also, fluid overload because of sodium also retention that will lead to hypertension, and eventually this will lead to renal failure. And in this case, when the patient reaches this end stage, he literally needs a dialysis or, sorry guys, a dialysis or renal transplantation, okay? But bear in mind that dialysis will just correct the hemostatic function of the kidney, like it will remove the toxins, wastes, but it won't be able to compensate or replace the endocrine function of the kidney. Yes, guys, kidney plays a major endocrine role, which is the production of various hormones, which we'll discuss in upcoming videos. So, what are the prognosis and outcomes in nephritic syndrome? Well, mild cases may resolve with appropriate treatment, management of underlying cause, easy to treat. Severe cases, well, it's not good because it can progress to chronic kidney disease and end-stage renal failure if not managed. Early diagnosis is crucial for timely intervention and improved long-term outcomes, and we literally prevent complications that we don't want the patient to fall in. Ongoing monitoring, regular follow-up, monitoring of the kidney functions is essential. All right, guys, that's it for tonight's lecture. Hope you guys understand the concept and the nephritic syndrome topic. So guys, we'll meet you in the upcoming videos. We'll literally discuss the nephrotic syndrome and we'll do a comparison between the nephritic and the nephrotic syndrome. So stay tuned, guys, and stay safe.